Good afternoon, Dr. Trinh. Thank you for being with us today. I almost feel like I'm with Dr. Oz when I'm with you. You have such a wealth of information. And what I would like to do is hear a little bit about you, and then I'd like you to talk about cancer and your research in regards to cancer what causes it. And this will be just a quick snippet. So thank you for being with us today.
Yeah, thank you, Edna, for inviting me to come chat with you. I'm Dr. Trinh. I'm a board certified internal medicine specialist and have been in practice for close to 20 years. And I'm also in the field of medical research and clinical trials and things of that sort. The majority of my patients are older adults. And because I take care of a lot of older adults, I run across cancer all the time, which is why it's been a passion of mine to go out and speak on this topic and to speak about what we can do to minimize our risk for cancer. And other than the obvious procedures for screening that we all know about, colonoscopies for colon cancer, mammograms for breast cancer, prostate exams and PSAs for prostate cancer. Those things we do routinely, at least here in the United States. I wanted to take a step back and in my full lecture, when we have a chance, I want to discuss about why cancer even exists. What is cancer, right? And is it only genetics? Is it just a mutation? Or is it something that we can address and minimize with our lifestyle? And what are the treatment options for cancer other than, chemotherapy and radiation and surgery, which we all know of? What are the upcoming research that's being done to address cancer? And I can tell you now that there are certain health conditions that increases our risk for cancer. Little do we know, and many do not realize, that there are probably about 12 cancers that is connected to one health condition. 12 cancers connected to just one health condition. Yeah, you happen to know which one that is, Edna?
I would imagine it has something to do with your diet or obesity or something to that effect.
Yes. We have tied 12 cancers to obesity, guys. Obesity, yeah. And it's kind of crazy because, and it's also kind of scary because in the United States, 2 out of 3 Americans are overweight. And maybe that's why cancer is the number 2 killer in the United States, right after heart disease. And if we knew that, boy, there are many strategies to address obesity. But beyond obesity, there are other health conditions. And there are other ways with our lifestyle that we can address, that we are in control of, to minimize our risk for cancer. And in the longer lectures, I would love to discuss that with you. A lot of it has to do with terminologies such as autophagy, sugar and the toxicity of sugar, the role of intermittent fasting. And so all these terminologies I just threw out at you has a role to play with the reduction of cancer. And when we have a chance to do a longer lecture, we're going to talk about all that.
Well, thank you very much, Dr. Trinh. Thank you for being with us today and giving us this information. And we look forward to our longer lectures where you're telling us a lot more and not leaving us with cliffhangers like this. Thank you so much and have a good day.